will be talking about the cardiac cycle. This is defined as the heartbeat from the beginning to the next. The way the blood moves through the heart is it comes into the vena cava, into the right atrium, through the atrioventricular valve, to the right ventricle, and then out of the pulmonary arteries, which go to the heart. They go on both sides, and they're about right here on the heart. After the blood is done being oxygenated, it comes back to the heart from the pulmonary veins that are on this side, and it fills the left atrium with blood, then comes down the atrioventricular valve into the left ventricle, which then comes up the ascending aorta and out through here to the rest of the body. During this, there are two heartbeats that are audible to the human ear. The first heartbeat is known as S1. That is when the bicuspid and tricuspid valves are closing. The tricuspid valve is over here on the right side, and then the bicuspid valve is on the left side of the heart. The second heartbeat, known as S2, is when the aortic and pulmonary valves close, which marks the end of systole. The aortic valve is right here, and the pulmonary valve is right here. There are two terms for the heart. They're called systole and diastole. Systole is when blood is gathered in the heart so that it can leave and pump through the rest of the body. Diastole is when the heart refills with blood after it has already left. Atrial systole is when there are contractions in the atria, which are right here and right here, and it pushes blood into the relaxed ventricles, which are right here. Then during ventricular systole, the contractions in the ventricles push the valves closed, and the semilunar valves open and blood is ejected out of the heart. Ventricular diastole is when blood flows into the atrium, and at this point the atria are relaxed, and the blood is flowing from relaxed ventricles as well. And when all of the chambers, which means both atriums and both ventricles, are relaxed, that means that the ventricles will fill with blood again, but passively. There are a few more terms that should be known when dealing with the heart, such as end diastolic volume. This is the amount of blood that fills both ventricles during atrial systole and atrial diastole. End systolic volume is after the blood has left, there is always that small amount of blood left in the ventricles. There is a dichrotic notch also when discussing the heart and the heartbeat. This is when the end systolic volume is reached and the high pressures in the walls make the double beat sound, which is why we hear heartbeats. Isovolumetric contractions refers to when blood flows through the aortic trunk and the pulmonary trunk. And then isovolumetric relaxation is when blood does not flow through the ventricles at all. And that is the cardiac cycle.